I was at a conference, it was WPATH conference in Thailand many years ago. I asked Dr. Toby Meltzer, the surgeon, how to do a block that would help people during genital electrolysis. And on a napkin during a dinner cruise in Thailand, Dr. Meltzer was kind enough to show me how to use or how to perform a spermatic cord block. And I tried them many times. In my hands, I found that field blocks or local infiltrations were more effective. What I do is I use BLT first, and then I do the injections after that. I generally use a combination of either 1% or 2% lidocaine along with normal saline or sodium bicarbonate. There has been a shortage of sodium bicarbonate, so we haven't been able to use that. I use very tiny needles for injection. We use 30 gauge needles. Now remember from an earlier lecture that a 30 gauge needle is 1/30th of an inch in diameter, so it's very, very tiny, but that's appreciated. Warnings. It's important that lidocaine or Marcaine can be purchased to be used with or without epinephrine in the mix. Epinephrine keeps the medication in a constricted or contained area, so it also helps it to kind of last longer. It doesn't diffuse out into the areas nearby. But for safety, we do not use epinephrine with our anesthesia in the genital area. So there's an adage that goes fingers, toes, penis, nose, no epinephrine, because the epinephrine can constrict the blood supply and it can actually endanger the tip. So the tip of the penis, the tip of the finger, the tip of the nose. Bad to see tissue loss in any of these areas. When starting out, I had asked the dentist upstairs if he would do dental blocks on our patients who came in for facial electrolysis or laser. And he said, Linda, I'll show you how to do it. It'll just take me a few minutes. So I learned how to do an infraorbital block and a mental block, and those are very helpful for facial procedures. Now I'm going to show you a couple slides that require a trigger warning. So if you don't want to see injections demonstrated or needles, please look away. There is actually a special syringe called a dental syringe. This is not it, but we can order these for our facial procedures, and they work very, very well. The infraorbital block numbs the upper lip, but it can also spread to the nose and the eyelid, which was alarming to me at first. But when I inject, you go in underneath the upper lip, and you're targeting the area where the infraorbital nerve comes out. And that's actually a little hole that you can feel just underneath the lower lid. It's about, like a couple of centimeters below that, but you can actually feel that with your finger. I've learned to aspirate while I'm injecting so that I avoid injecting into a blood vessel. I inject very slowly, and I give this medication time to work. Now, the next slide will show a mental block. So here the injector is going into that little sulcus in the lower jaw, and this helps to numb the area for lower lip electrolysis or chin electrolysis. It's very helpful. And by the way, just looking at these slides, I don't think is adequate training to learn how to do these blocks, but it gives you a good idea of what we do. So finally, in some circumstances, I have found that there is a legitimate need for oral narcotics and for anxiolytics, or I should say and/or. Oral medications are not needed very often, but there is an occasional time when I will prescribe them. Be careful when you do that, though, that a patient doesn't drive after using an oral narcotic or an anxiety medication. So after their treatments, they should be walking, taking the bus, getting an Uber or a Lyft or a cab, having a friend drive them, but they should not be the driver if they have had these medications during our treatments. If you are using narcotics on patients, it's important to have Narcan on hand. So this is the information that I have today. You know, it's been very important for me to provide these services, and I felt that if I was going to offer this type of hair removal service in my clinic, I would do so with adequate pain relief. You know, it seems to me that if you don't have these pain medications available, that it's just another punishment for being transgender. And in my opinion, people don't need more punishment, for heaven's sakes. It's hard enough out there as it is. So I hope that this information has been helpful to you today. Please share it with other people who may need it. Please like my YouTube channel and subscribe to it if you haven't already. Thank you so much for watching, and I'll see you in the next video.